healthcare brochures are marketing materials. Like most companies that give employees these thick-ass PDF packets that feel like, oh, this is designed to, help me choose my plan. If we're thinking about it like a marketing material, I'm starting to think that maybe that's not really what they're for. Are they actually helpful?
So I hope you're ready for my soapbox.
Soapbox away.
Thank you. So yes and no. They are the place that you start, right? To understand what options your employer is providing you, what will be the deductible versus the co-insurance versus the copay. But they're not the only place you should look. So I mentioned previously that the pretty packets are 100% marketing. If you're ever looking at a document about health insurance that is not the most boring piece of paper you have ever read, then it is marketing. And so let's just take a step back for a minute. So some of these brochures, I've seen some crazy things. They'll call a plan the consumer choice plan. Well, like, why would I not want to be in the consumer choice plan? Mm-hmm. First, there is no such thing as a consumer choice plan. That is a marketing term to not say high deductible health plan, because that kind of sounds a little scary. And really, they'll have things that say the lowest cost option. Or one of my favorites was, a majority of your coworkers opted for this plan last year. Great. Awesome. Why is that relevant? So in essence, to put this in a bit more context, when an employer offers a healthcare benefit to an employee, it comes at a cost to them as well, right? So they go to the health plans, the Aetnas, the UHCs, and they say, okay, here's my group of employees. I want to offer them this plan. What can we do? And health plans can use big data, right? And they can analyze it and predict pretty well, based on the population that the company has, how much they're going to spend in a year in healthcare. And then they can start to devise plans accordingly. And then it's up to the employer to say, okay, for each employee, I'm going to shoulder this much cost, and I'm going to give the rest of the cost to the employee. So you can start to imagine that, there's tons of variables that they can play with to change these costs. But at the end of the day, they really hope you pick the one that's more advantageous for them. And that's what the pretty brochures do. So when the benefits guides come in, bottom line is that you use it as a starting point. What you need to look at is the really ugly, thick, confusing brochure. And those are called the detailed medical benefits coverage. And the reason that's so important is because this is going to be the litmus test, right? For when you have something weird that happens, or maybe even not that weird, just weird to you. This is what's going to decide if it's covered, if not, how is it covered, etc. That's also where you're going to learn things like if there are any exclusions. If your in-network plan, for example, has an emergency clause, or, if you need a hospital and you really can't find one that's in-network, are you kind of screwed? So a quick example, your benefit summary document will say something like, you have a $100 hospital copay. Your detailed medical summary will say, unless you're having a baby, then it's $500 for you and $500 for the baby. So these are really important things to look at. Do your due diligence. And if something isn't really explicit, so if you have a rare disease or an autoimmune disease and you're going to need a certain therapy, do Control F in that huge document and see if it comes up. If it doesn't, call the plan, ask for clarity, and ask them to email you that clarity so that you have it for future.
Enjoying your trail, baby.
Yeah, exactly. A few other critical steps. The biggest one being is that you have to confirm your network status for all of your providers. We're in an in-network only plan, so this is extremely critical for us. But even for those who aren't in an in-network only plan, you'll end up paying more of a co-insurance, for example. For something out of network, sometimes out of network costs won't go towards your deductible at all. So confirming network status is critical.
And so the big ugly packet that you just mentioned is the detailed medical benefits coverage. And to Sarah's point, you have the right one if it's ugly and boring. If it's like flowery and uses language that tries to steer you in one direction or the other, it's probably not the correct document. Yeah. This is also funny because ever since our first episode about this, I have been so much more diligent about getting in writing confirmation that a doctor that I'm about to see is in network and having screenshots of everything and really taking it upon myself to assume that if this gets denied, it's going to be on me to prove that I was allowed to see this care provider. So just something to note. And on that same kind of in-network, out-of-network status thing, you mentioned calling each plan and checking the network status for all providers. I imagine you're referring to providers that maybe you already have an ongoing relationship with if you have some sort of, whether you have a chronic illness that requires you to see specific doctors or you just have a primary care physician that you like. Can you elaborate? Because I could see someone kind of hearing this advice and being like, well, I don't know where to start. Can you give us an example script almost of what you would do and say if you were doing this?
Yeah, absolutely. So this is an awesome question. So first, let me take a step back for a minute because your employer, again, should be providing you with links to each provider network. So my employer offers me the option of a UHC network or an Aetna network. And they can be very different. And again, they can be different if I enroll in the UHC PPO or the UHC Consumer Choice Plan. But they should be giving you a link. So you can go in, even if you aren't enrolled, and use that link and type in every single doctor. I would also type in, hospitals in your area. If you know that you travel somewhere for long-term amounts of time, you're visiting family, type in hospitals in that area as well. And make sure that you're in network. If for some reason you can't readily find that link in the pretty brochure, the first thing you should do is reach out to your HR department and say that you would like a link to confirm coverage of your providers prior to selecting your health insurance plan. If that still fails, the big ass boring book will absolutely have a 1-800 number that you can call. Call it. Let them know, hi, my name is Sarah. I work for X company, and I would like to confirm coverage for 2023. They'll ask you, which plan are you looking into? You'll say, I'm looking into the PPO plan because the girl on the internet said, don't do the high deductible health plan. Just kidding. You should definitely do it. And then they will ask you to give names of your providers. Again, you'll give them the names. They'll tell you if they're in network or out of network. There are 3 key follow-up questions here that I would, again, write down, and I'm happy to give these to you to share in the links below. But first, have them confirm the provider address. So make sure that the Dr. Smith you're referring to is the Dr. Smith that they're looking at on their screen, because it's absolutely happened where it could be a different Dr. Smith. Ask if the entire practice is in network. Sometimes a doctor can be in network, but say, for example, the nurse practitioner is out of network. Or in my case, we had my OB-GYN was in network, but the radiologist who read ultrasounds was not in network at her office. Now, in a hospital setting, this is taken care of due to recent legislation. But when you're talking about, cardiologists, specialists, or even just your PCPs, it makes a difference. And then finally, ask them to send you that information in an email. Again, nobody's going to care if you called Sue and Sue told you this was in network. You really need to be able to pull up the email and say it was in network.